Good morning, everybody. Guess what? We are live with Community Healthcare in Franklin. I have Cindy and Dorothy with me. How are you ladies doing this morning?
Great, Donna.
Wonderful, Donna. Thank you for having us.
So we're excited we've been highlighting different people in our community. You guys do a special service. Can you tell us a little bit more about Mercy Community Healthcare?
You want to? I will let you know. I'm Cindy Seiler. I'm the CEO at Mercy, and I'm blessed every day to get that opportunity to serve folks. And Dorothy Bullard is our Chief Business Development Officer, and I'm going to let her tell a little bit about what our services are in a moment. Our mission, Donna, is to reflect the love and compassion of Jesus Christ by providing excellent health care to all and support to their families. And one of the things that we have tried to do throughout our staff is saturate ourselves in that so that our actual patients feel that when they come in. We also have a vision statement that I wanted to share because it gives a little picture about who we want to be. We want to improve the health in this community with our individuals and families by meeting their physical, mental health, and their spiritual needs as we can through the healing power of Jesus for generations to come. And so that's something we've been here 20 years and we want to be here 20 more. And then the other thing that we really work toward are our values as a corporation, compassion, excellence of service. We try to be an innovative community champion within our community, wherever we serve, with integrity and stewardship and teamwork. So I'm going to ask Dottie to tell a little bit about the depth of our services.
Well, as Cindy said, I'm Dorothy Bullard, the Chief Integrated Care and Communications Officer, and actually Chief Business Development Officer. My title has changed a number of times, but I just want to share with you about the services of Mercy, and that we are here, as Cindy said, to provide excellent healthcare services to all and to their families. And in doing that, we do it to the glory of God. And we want to wrap our arms around our families and provide primary health care for them. And that's of all ages, from birth to the grave. We do that with love and compassion. We also provide psychiatric care that's under our mental health umbrella, and counseling services to our families. And that, again, those services are for all, from children to adults. We also have care coordination services, which is different from most other community healthcare centers, and that our care coordination department actually completes the Mercy Healthcare Hub. We act as an arm of the nurses and the providers in accessing services for patients as ordered by the providers. And we also help them with those social determinants of health needs. And that includes if they're struggling with having housing, if they struggle with food, or their children need access or need someone to advocate for them via IEP services in school. The care coordination department is there to help. We also have certified our certified application counselors through the marketplace that will assist anyone with services and assessments for insurance, healthcare insurance, and we can provide that for anyone in the community that needs that, and that's done through our care coordination department. So we always look at what is done there as completing that healthcare hub, and again, we do it to the glory of God, with compassion and love, and all the services from primary health care to our care coordination services are done with love and compassion because we love what we do in the community.
Yeah, you guys have been around for a long time. So just so people understand, you also won't turn anyone away for if they need to be treated. Is that correct?
Exactly. We do not turn anyone away because of their inability to pay. We have a sliding fee scale. that patients can apply for. We work out details of that with our families. And if there are any other services, like I said before, we can send them to the care coordination department to help, but we do not turn anyone away because of their inability to pay.
We're both a ministry and a federally qualified health center, Donna. So there's a lot of people don't understand that there's a blend that because of the ministry, we would never want to turn anyone away. And we want to reach out to as many people as we can. But in addition to that, being a federally qualified health center, that's part of our federal regulation that we have that sliding fee scale that Dottie's talking about.
Right. And as a federally qualified healthcare center, that means that we accept a grant from the federal government. And being the federally qualified community healthcare center, there are certain guidelines that we follow. But above all, we have a ministry, and that is the ministry of showing the love and compassion of Jesus Christ. And so we can pray with our patients if they want us to, and we always ask our patients to pray for us in this ministry. So that's why we say that we provide services to the whole person. That means our primary health care, our mental health and counseling services, our care coordination department, and reaching out to the community as innovative community champions to the glory of God.
So during those COVID-19, you guys have told me that your clinic has remained open, but yet you've seen a decline in patients. Can you talk to me about that?
Yes, COVID-19 has had an effect on all of us. I think the new normal is still out there. We're not sure any of us are what we're going to do. As we talked before, there's going to be a lot of drive-in everything. But we have had a reduction of patients, obviously, just because of the governor's order to stay home. And we want to abide by anything that our elected officials have said. We're very appreciative, honestly, of our local and state and federal officials that have helped flatten this curve and do what we need to do. But during this time, because of what Dottie said about us being a federally qualified health center, one of the things we do, Donna, that it belongs to any FQHC is we have an emergency preparedness committee, and they meet monthly even when there's not a crisis. And so they jumped in immediately and began to order the PPE and began to change our policies and make it safe for our patients and have extra cleanings and all of that kind of thing. And then we went from that to a multidisciplinary team that literally met in the morning at 7 o'clock and in the evening before they went home to make sure we'd done everything we could do and to reach out to the people that we need to make sure we're following those changing policies, because for a while they were changing every day and we were just doing the best we could do like everybody else. Our patient load has gone down. We're down about 40%. Last year we saw 11,076 patients. And so if we move on to the trajectory that we're on right now, it's going to be much less than that. And so we want to encourage people to understand we are doing everything we can to keep our patients safe and our staff safe so that they can care for our patients. I'm very grateful for our staff. They are heroes in our minds because they reach out and do everything that's needed. There's several stories we could all tell, but just coming over, walking through the clinic, through pediatrics and to the adults and through the psychiatric area, all of them in the yellow suits, in their PPE, everybody with masks, doing what we're there to do, to serve. And as administration, we're extremely grateful for them and everything that they've done, and extremely grateful for the healthcare folks across our community. Our health department is awesome. We work in collaboration with them and excuse me, and the hospital on a regular basis. And we are blessed to not have had that many positive tests. We just haven't, and I don't know what that says about our population, but we're there to serve as they need us, and want to encourage folks to come on in.
Yeah,
Right.
during this time, as we've all been like staying at home, obviously to keep everyone safe, some people have really struggled. And the month of May is Mental Health Month. Can you talk to us more about that and what you guys are doing there at the clinic?
Okay. Yes, it is. The month of May is Mental Health Month, and so um, our counseling department provide outreach and education to our community monthly with monthly communications and fact sheets about what to do if in certain situations, and so they continue to do that through the month of May. We want to say that. We've been told, and everything we read tells us that this time with the pandemic, families are affected mentally. And so we want to say that Mercy is here to serve you. And we want you to come in and be a part of what we're doing and allow us to care for you, because we have wonderful, wonderful counselors and psychiatric providers. As a matter of fact, our counseling department was given the Sizzler Award for
Yes.
the best counseling services in Franklin, Williamson County area. So, kudos to our counseling department. I must tell you that when you walk into our counseling center, it is
Yeah.
and it's such a wonderful, calming, and relaxing place. It's not cold and sterile at all. Not that other places are, but our counseling center is special. And our counseling staff, our therapists, and the director, chief officer of behavioral health, Jonathan Boy, is an incredible young man. And so I see why we have been given the Sizzler Award, because it is an awesome service. And so I do encourage families and anyone in the community that need these services to please contact us at Mercy. Call us and schedule an appointment, because mental health is real. And we know in the community it is almost like an epidemic now. And this time with the pandemic, we are affected, all of us.
Right.
And so we want to be of service to you here at Mercy.
We if I didn't mean to interrupt you, Dottie, but we immediately went to telehealth counseling, Donna, and our psychiatric department moved into it first, and then our counselors, as Dottie's talking about, so that we would have both available. And we actually have counselors in 31 schools in the Middle Tennessee area. And so when the schools closed, it was devastating to us. We had to lay off some of our staff at that time. And as we've tried to bring folks back, or at least to provide those services to the schools and work with Williamson County School and Marshall County School systems, we've connected with the social workers and have actually been able to reach out to those families and those kids that we were serving, and do that through telehealth. So once again, that new normal may never come back. Folks are going to like this part of
Yeah.
So now we can't do new patients that way. New patient intakes have to be face-to-face for our billing purposes and just for practicality. But anything that we can do through telehealth. And we just recently moved last week into telehealth with our primary care. So some of the well visits and sick visits can be done that way. And we are, just to answer your question, we are also trying to open our services with some expanded hours. And as things open up, we know and realize there's people in our community that are going to need help. And when they go back to work, they're not going to be able to miss work. So we're going to try our best to be available and have access to them in the ways that we can. So some of that will stay tuned, and we'll give new hours and that kind of thing later.
Yeah. Let's talk about celebrating, because today is part of the big payback, and you have an event talking about doing things differently. It is a drive-through ice cream social, which is coming up at 11 o'clock today. So if people have nothing to do or want to come by and see you guys, tell us how that's going to work.
Yes, and it's during lunch hours, so you can take your lunch breaks and drive through. get ice cream that has been given to us by Bluebell Ice Cream. So thank you so much, Bluebell, for supporting Mercy and providing the ice cream. We will be giving the face mask and a little first aid treat to everyone that drives through. It'll have hand sanitizer and a first aid kit with another little treat in there from Mercy, along with face mask. And so it is the big payback today. It goes until 6 p.m. today. Our ice cream social is from 11 to 1. So please take your lunch break and get the family and put them in a car and drive through, because it is a drive through.
And where is it, Dottie? It's located in the Williamson Square.
It's located in the Williamson Square shopping center, in the area where we have the salon and painted trees in that parking lot side of the Williamson Square shopping center. So please come by and support Mercy and get your treat and ice cream as well. So we want people to come out and just enjoy that and share with Mercy. So yes, we're doing that. This is also Nurses Appreciation Month.
I was just getting ready to say that. You can drive by and say thank you to all the nurses.
Yes.
Honk your horn.
Yes. And so actually we want to say thank you to our nurses who have worked so hard, especially during this time, this pandemic, to be there to support our patients and to do anything that they need to do as a part of the team to help Mercy and our families who come through. And so we appreciate them and all of Mercy staff and frontline workers who have worked so hard during this time and continue to work. So we want to say thank you to all of them.
We have about 30 nursing staff, Donna, and they are just simply amazing. Our interim director of nursing is Beth Ann Wilmore, and she's just a ray of sunshine. And when you walk through, all of these guys are smiling through the mask, and it's just a blessing to see them. We were talking yesterday about how can we show people that we're smiling since they can't see our mouth. You know, everybody's been practicing smiling with their eyes.
I've seen those masks. Have you seen them? I can't remember where I saw it, but they do have a smile on the outside of the mask. Have you seen that?
We were talking about that this morning. We need to figure out something we can do that's a little special.
That's cute. Well, thanks for talking about the nurses in the event. Mercy is growing. As you said, you have more patients each year, which means you need more space. Yes. So talk about the future of Mercy and what you hope that will look like.
Well, we are growing, and we have outgrown, for the most part, our 4 suites that we're in the Williamson Square Shopping Center. And so that poses a challenge for us in terms of providing that excellent quality of healthcare that we want to provide and that our community has become accustomed to receiving from Mercy. So, and because of that growth, we have been working on a soft opening or kickoff to a capital campaign for a new building. And so we've not gone public with that. We've been working and planning during this COVID pandemic to enter into that quiet phase of the campaign. And so we will be putting out information soon, very soon, about our capital campaign and the need for this new building. And of course, we have people, staff that have been working so hard on the planning part of this. Our Nehemiah team that have been meeting at 7:30 in the mornings
before patients come in to plan the model of care for the new building and the layout for the new building and our services that we'll provide. So we've had a lot of staff working diligently to prepare for this and to put together the best plan and to have a building that will help us integrate at a higher level, because we do provide already integrated
primary health care and behavioral health and psychiatry services. But a new building will help us enhance that. It will provide us with the opportunity to serve more patients in the Williamson County and surrounding areas and Mercy service area. There, we have the opportunity to serve additional patients. And so there are, based on our market assessment, approximately 121,000 families out there that could benefit from Mercy services. And so we want to have a facility that will help us accommodate them and provide the best quality of care in the most efficient way, and to optimize what we do here at Mercy and the services we provide. So
it's very difficult where we are right now. You don't want to whine. Nobody wants a whine. but we have medical in one of the large suites, and then our care coordination is in another suite, and then our counseling center is yet in another suite, and then administration is in another suite. We don't like that as far as being family, to be separated like that. But even more importantly, we don't want to be separated in the services, as Dottie's talking about, the integrated care. We want a behavioral health person to be right there and accessible, and care coordination needs to be a look away, not down over the bridge, right. Over the bridge and through the woods to get to it. So yeah, it's interesting, and we're working on it and praying about it on a regular basis.
And as Cindy said, not only for the staff and having the services under one roof, but for our patients.
Yes.
We have, when you're in 4 separate suites, that means that a parent has to take a ill child who, might have a fever or whatever. They have to walk with them from a parking lot that, can pose a problem because we share it with retail customers. And so they have to walk to the medical center and the various suites. And if they need care coordination services, they have to leave that building and come across the little breezeway to another suite. And if they go for a counseling service, they have to walk quite a distance in the shopping area to the counseling center. And so that poses a problem for our patients. And so we want to do what's best and provide the best services for the community and our patients.
So during this time of COVID, Donna, we've been in a sort of a predicament in that we couldn't invite people to come and tour.
Right.
And so one of the things that we're trying to do is put together a virtual tour of our facility. And we would just ask the community to pray with us about that, and know that we're praying for everyone during this COVID-19 experience and journey. It's not going to be over soon, and we all need to just support each other and be together during this time as much as we can with social distancing and doing it appropriately. But as we move forward, we're just very appreciative, not only of our staff, but the community and the support that we've gotten. And thank you for giving us this opportunity.
Thank you. Well, you guys have been great, giving us a lot of information. Before we go, real quick, tell me the website where people can go check it out.
Okay, that is go to www.mercytn.org, and that's where you can access our website and learn more about Mercy and our staff. Our phone number, if you'd love to schedule an appointment with us, we would love to have you call and schedule an appointment. That is 615-790-0567.
And give us the address, because I feel like there's some people I'm getting hearts are going to come by for that ice cream social. So
good. The address is 1113 Murfreesboro Road, Franklin, Tennessee, and our zip code is 37064, and that's Williamson Square Shopping Center.
So when you see the Hobby Lobby and
Yes,
Garcia's
yes.
restaurant, we're behind it.
Yes, and our ice cream social is taking place just across the breezeway in front of Solar Salon and Painted Trees.
So you can drive up, get your ice cream, get a mask, and get some other goodies, and say hello to these ladies. Thanks so much, guys, for joining me this morning and telling us more about Mercy. I've known about you for a long time, and you've been a great asset to our community.
Thank you, Donna.
Thank
Thanks so
you.
much, and have a blessed day.
Yes.
All right. See you soon.
Your support. Thank you.